Now, China has been in news for over a week now over a mysterious respiratory infection. The country is grappling with a spike in respiratory illnesses as it is entering into its first full winter season since it lifted the COVID-19 restrictions. The Chinese government is calling for vigilance, with cases amongst children appearing to be especially high in the northern areas, including in the capital city, Beijing. And this has now sparked speculation online that there could be a new kind of infection that could turn into a pandemic 4 years after the COVID-19 infections had first emerged within China. Our next report gets you more details.
China is grappling with a spike in respiratory illnesses as it enters its first full winter season since it lifted COVID-19 restrictions. The government is calling for vigilance, with cases among children appearing especially high in northern areas, including Beijing. On Friday, Christian Lindmeier with the World Health Organization said it doesn't look like the spike is due to unusual or new pathogens.
In the current outbreak of respiratory illnesses, the reported symptoms are common to several respiratory diseases, and as of now, at the present time, Chinese surveillance and hospital systems report that the clinical manifestations are caused by known pathogens in circulation. Mycoplasma pneumonia is a common respiratory pathogen and a common cause of pediatric pneumonia and is readily treated with antibiotics.
The situation came into the spotlight earlier this week when the WHO highlighted a report on clusters of undiagnosed pneumonia in children. That's when it asked for more information from Beijing. On Thursday, the WHO said China had responded and provided data. Both China and the WHO have faced questions about the transparency of reporting on the earliest cases of COVID-19 that emerged in late 2019. Authorities began issuing health advisories this month, warning of long waits and the risk of cross-infection at crowded hospitals. Outside the Children's Hospital in Shanghai, parents said they aren't too worried just yet.
I hope people won't blame everything on the pandemic because there is one. Let's use science to approach an issue instead.
The WHO said the rise in cases of illness could be linked to the curbing of COVID-19 rules, along with the months-long circulation of the known bugs.
All right, so what is this mysterious and new respiratory infection that is sweeping across northern parts of China? To tell us more on this, we're being joined by Dr. Isaac Bogat, who is in fact an infectious diseases physician and a scientist. He's joining us from Toronto. Now, Dr. Bogat, there are these spate of infections that have been reported from northern China. They've been variously described as mysterious kind of pneumonia or some respiratory illnesses. What do you make of these reports that are doing the rounds?
Yeah, I mean, for starters, much of the world was aware of this on November 21st when it was reported on a global infectious disease surveillance website called ProMedMail. And of course, said without any xenophobia, said of course without any racism, which we have to avoid when we're talking about this. But when you hear respiratory illness, unclear what the diagnosis is, China, emerging infections, obviously the world gets concerned. We've just been through a terrible pandemic. We also remember 2003, where SARS emerged from. But on November 23rd, the World Health Organization had direct contact with Chinese health authorities, in which the Chinese health authorities said, yes, we're definitely having a rise in these respiratory illnesses, but these are known pathogens. This is influenza, this is COVID, this is respiratory syncytial virus, this is mycoplasma infections, which are known pathogens. We're just seeing a big rise of it in the first winter after lifting our public health measures. And people watching might remember that the same thing happened in many North Hemisphere countries, including the one I'm sitting in, Canada. We had the same thing happen last winter after we lifted many of our COVID-19 measures. We had a very large rise in pediatric illness and pediatric hospitalizations. It's very likely to be the same issue in China.
Now, according to the reports, this is what is being said, that most of those who are taking ill due to this new infection are young children. Now, how concerned would you be as a physician about this?
Obviously, anytime we hear that anyone's getting sick, we're concerned. Of course, when we're hearing about children getting sick, we're concerned, and we've sadly been through this, and it was very tough. It was very challenging. So by no means would we want to say, oh, it's just a rise of infections after lifting COVID measures, nothing to see here. No, that's still a big deal, because at the end of the day, you have a lot of children that are getting sick, many of whom are requiring emergency care and hospital care, and you have to be able to care for your population. You don't want ill on anybody, and I wish everybody impacted has a very speedy and complete recovery.
Absolutely, indeed. Thank you very much indeed, Dr. Isaac Bukach, for joining us and getting us that update there.
My pleasure.
WION is now available in your country. Download the app now and get all the news on the move.